13 years ago, I was diagnosed with a stage 3 triple-negative breast cancer shortly after my son Luke was born. On Mother's Day in 2011, Fox News Sunday documented our family's journey.
We lost a little bit of innocence this year, but what we gained as a family in terms of them understanding that life isn't always fair, and that if you're strong and you set your mind to something, you can get through it. I think we gained a lot more than we lost.
Many members of our audience have shared with me their own cancer stories. Each year in the United States, more than 264,000 women a year are diagnosed with breast cancer. About 42,000 women in the U.S. die each year from the disease. 10 to 15% will be diagnosed, like me, with triple-negative, an aggressive form that until now has had no drug that can halt a deadly recurrence. Dr. Keith Knutson and his team of researchers at the Mayo Clinic in Florida, with an initial $13 million grant from the Defense Department, have made enormous progress on a possible vaccine. It not only might prevent a recurrence of triple-negative breast cancer, but also may eventually be given to women to prevent all breast cancers, using the body's own immune system. Dr. Keith Knutson joins me now. Doctor, welcome to Fox News Sunday.
Thank you. It's great to be here.
Are we one step closer to a cure? Why is this such a significant breakthrough moment in cancer research and treatment?
Well, cancer is really just a multitude of different diseases, and even within breast cancer, there are lots of different subtypes of breast cancer. And so it's very important to try to understand what you're going to target and how you're going to target it, and then go through the steps that you can show you can target it and it can be safely administered to people. And it's a challenge, and it takes several years to do this, and you really need to stick with it. And that's the important steps that we go through as we of course, research in developing cancer vaccines.
How do these cancer vaccines work?
Well, not too unlike an infectious disease vaccine. So what's all on our mind right now, of course, is COVID vaccines, and it's not really too different than that. What we want to do is we want to identify what is foreign and then use that foreign substance, and typically that's a protein, and administer that along with an immune activator called an adjuvant in some way or another, stimulate the immune system so that it forms either antibodies or T cells or both. And then that gives you the power to fight off the disease should it occur, later or tomorrow, or, at some other point in your life.
Tell me about your two most significant trials for breast cancer.
We have a number of different clinical trials that are ongoing, and there's three ways to think about how we approach the development of vaccines. The first way is to use vaccines to shrink a tumor. The second way is to use vaccines to prevent recurrence in individuals that have been previously treated for cancers. And the third way is to use vaccines to prevent the cancers right from the get-go. That's called primary prevention. So the trials that are ongoing right now in our group and several other groups across the country are to use vaccines to prevent recurrence. So you had spoken about the triple-negative breast cancer vaccine that we have. That's very advanced for us. It's in phase 2 clinical trials. The next step is phase 3 clinical trials. And the phase 2 clinical trial was just recently fully accrued. So we have 290 patients. Several of those patients have been treated with placebo. 2/3 of them have been treated with the vaccine. These individuals don't have cancer right now. The idea is, can we prevent the cancer from coming back?
And finally, what are the women in your studies telling you about receiving these vaccines, how it makes them feel right now?
Right. So the unlike an infectious disease vaccine where you can rapidly assess in the population whether there's an infection, we need to wait. So despite the fact that we have accrued the 290 patients on study, now really the challenge begins is try to understand who's going to relapse and who's going to be protected from disease. And oftentimes that takes years to evaluate. So we've got, probably another 2 to 3 more years where we'll be evaluating these patients to see if vaccine has any activity.
But can you see one day where we can actually have a cure for cancer, and will these vaccines play a role?
Absolutely, absolutely. So in recent times, there's been a tremendous amount of effort from not just our laboratory, but other laboratories around the country to using the knowledge that we now have with respect to the immune system and what we can target in cancer to develop vaccines that can prevent cancers from happening in the first place. So our team is partnering with the National Breast Cancer Coalition and the National Cancer Institute to develop a primary prevention vaccine for breast cancer. We're not just talking about triple-negative breast cancer, we're talking about all of the breast cancers, the 260,000 cases per year that was initially brought up as is the number of cases in the U.S. that we have every year with breast cancer, and preventing that, or at least rapidly reducing the incidence so that we don't have to deal with the advanced stages of the disease.
Well, Dr. Knutson, from my family and from all women in the United States, thank you very much.